Good evening and thanks for staying tuned. Welcome to our COVID-19 update. I am Ladi Akeredoluale. Here are the highlights at this hour. Central Bank of Nigeria supports gradual easing of the economy, expresses desire to help it avoid recession. Federal government to set guidelines for the treatment of people with disabilities in the era of COVID-19. And UN Secretary General calls for debt relief for all developing and middle-income countries to mitigate COVID-19 pandemic effect. The Monetary Policy Committee of the Central Bank of Nigeria today backed the gradual easing of the economy, saying it will improve economic activities after the negative impact of the COVID-19 pandemic. Its governor, Mr. Godwin Emefiele, during the MPC meeting, that's the Monetary Policy Committee meeting earlier in the day, said that the disbursement of stimulus packages to households and critical sectors of the economy to cushion the effect of COVID-19 are just some of the measures necessary to stimulate the economic recovery of the country. The committee maintains that although a sharp decline in output growth is expected in the second quarter of 2020 and maybe the third quarter if the current stimulus initiatives are properly implemented, the economy would reverse to positive growth by the fourth quarter. The Director General of the West African Health Organization, Professor Stanley Okolo, says the Nigerian health team is on the right path in tackling the global pandemic. Professor Okolo was speaking today in Abuja at the Presidential Task Force briefing, where he also explained some of the challenges faced by the organization in finding solutions.
We at WAHO are extremely encouraged by the sterling efforts of the Presidential Task Force, the NCDC, Ministry of Health, and all the ministries that are involved in combating COVID-19. What you're doing is really what we expect. We at WAHO, 2 weeks after this incident was declared a public health emergency of international concern, convened a meeting of all the ministers in Bamako to agree a regional approach. As at now, we have about 3 different approaches, but that's fine, because it is not a problem. The fact is that people move at their own pace. We have the problem of the supply chain, and that's one of the things we're trying to do to try and burst this disruption in the supply chain. WAHO has been extremely active, and we have been successful to some degree, thanks to some of our partners, United Nations Development Program, UNDP, GIZ, and the Jack Ma Foundation. And so we are looking at how we help countries to procure materials. We also have the issue of humanitarian corridor. So we know that during Ebola, there were 3 countries, we could take rapid response team from one country to another. Now everybody is consuming its own smoke because it affects all the countries, but there are some countries that are weaker than others, and we would like to send people to them or even send materials. That is an issue for us. And then the final thing is data, modeling. Chikwe has mentioned the issue of how the modeling might help you plan. But really we do need that, and it is vitally important, because part of the issue why it's a challenge is because there are so many unknowns that go into a modeling. When you model in the Western world, you can determine the number of people you think will have the case. You can model for family homes. We can't do that here. And that is one of the things that we, therefore, as we model, we know there are a lot of caveats to it.
Meanwhile, the Presidential Task Force itself says that there will be specific guidelines being brought out on persons living with disabilities, and this will be broadly in line with those already released by the United Nations. The National Coordinator, Dr. Sani Aliu, explained that guidelines at the national levels will be made available within a specific structure.
There are actually guidelines produced by the UN Human Rights Community on Disability, But disability alone may not be related to a higher risk of COVID or the severity of the illness. But nevertheless, people who are disabled may have more difficulty accessing care. They may also have more difficulty accessing information on how they can protect themselves. And we acknowledge this. We also acknowledge the rights of people with disability. And I'm sure appropriate guidance at a national level will be made available.
People living with disabilities is a very broad community. So we'd rather address it within the specific sectors and within the remits of those specific disabilities. So it's very difficult to make guidelines for populations like that. They're all citizens and they'll be considered. So when we do the aviation guidelines, they'll be considered in those guidelines because there are specific issues around them. I think we all take them very seriously.
Dr. Sonia Liu spoke first, and then Dr. Chikwe Ihekwazu, the Director General of the NCDC. Now let's cross over to Borno State, where the physically challenged persons are seeking government support in the face of the COVID-19 pandemic. They're worried about the lack of protective materials for their members. They also say the lack of sustainable source of livelihood has pushed them to the streets without recourse to safety protocols prescribed.
Physically challenged persons are the most conspicuous fragment of the population in Maiduguri, the Borno State capital. You find them in major streets every other day begging for alms, their major source of livelihood. Now we understand that there are an estimated 3,000 of them registered under the Union for the Physically Challenged in Borno State, and we are also told by their officials that at least 70% of that number rely solely on begging for alms, and this predisposes them to the risk of contacting the coronavirus. Now, a few weeks ago, when the Borno State government imposed a total lockdown in the state, this group of people came face to face with hunger and hardship. But then, fortunately for them, when the Borno State government began to share palliative among the poorest segments of the society, this group of people were prioritized. But then the physically challenged people believe that there is more the government can do to make them self-reliant and keep them off the streets, especially for such a time as this.
If you look at our people, some of them, if you consider 100%, 70% are still begging, some of them. So when they go to begging, anybody has that disease can transfer them immediately. So we have to orientate them always and always.
All it is a sustainable approach, something that is sustainable. I think we'll start by going by maybe a stipend every month, then empowering them with jobs, educating them, empowering their own minds so that they will know how bad it is to be begging on the street, the challenges of begging on the street. Aside from it's not really sustainable and there are a lot of hazards as per vehicular accidents and maybe getting abused, being vulnerable. They are more exposed to assaults and other things like that.
Now, apart from the coronavirus, the continuous roaming of the streets by those people exposes them, to other dangers and vices. From Maiduguri, the Borno State capital, I am Blessing Tuno Aso for COVID-19 updates.
Joining me in the studios at this point is Mr. Danlami Bashar. He's the chairman of the United Nations Committee on the Rights of Persons with Disabilities in Nigeria. Thank you very much, Mr. Bashar, for your time. Thank you for coming in.
Thank you very much for having me.
The federal government says it is going to release a set of specific guidelines, which will broadly be in line with what the United Nations and Human Rights Commission and Human Rights Committees have already done about the rights of people with disabilities. Do you think, given our own experience with COVID-19, do you think this will be adequate to protect them at this time that we're also battling with COVID-19?
Well, it's very interesting to hear the federal government say they will work on the rights of persons with disabilities coming this late in the day when COVID-19 has ravaged everywhere. And you agree with me that persons with disabilities have been worst affected in the COVID-19 pandemic.
How so?
Well, persons with disabilities need a lot of support, particularly blind persons, deaf persons. They need a lot of support to get around. And with the issue of physical distancing, you agree that blind persons are worst affected because they operate by touching. So they have to touch whoever they are with, who is supporting them. And then, of course, there hasn't been sufficient information for some persons with disabilities like deaf persons. There's a lack of sign language interpretation on television, in press briefings and so on, and so that has really affected deaf persons. And then it's unfortunate that the COVID-19 has become a tool for abuse of persons with disabilities, by which I mean that some people with disabilities have really been battered as a result of this COVID-19 lockdowns and so on. For example, I know very well that a friend of mine, a blind person who was trying to support his group by trying to distribute palliatives to them, was actually brutalized by, a security person. And so, as a result, we've not really fared very well. And then distribution of palliatives has been very, very difficult. It hasn't been reaching many persons with disabilities. It's been reaching them in dribs and drabs, but it's not enough to actually ensure that they can stay at home, and get their livelihoods. So there's a lot that...
I remember that first of all, I think that the Presidential Task Force itself now provides, of course, language interpreters for its press briefing. So maybe that may be a step forward for what you're saying about not being able to follow some of the information, particularly for those who are deaf, not blind people.
Yes, I know. Yes, the PTF has been doing its best to provide sign language interpretation. Unfortunately, we find that during the interpretation itself, the camera is often not even on the person interpreting. So a lot of the information is missed. And then that is only in Abuja. What about the rural areas? The deaf persons in the rural areas, they don't get any information. And the blind persons, of course, have not had any information provided to them in written form, in the form they can access. That is Braille. But, well, fortunately, they can listen to television or radio, but it's not enough. They need information in writing.
Have you been, has the PTF or any of the agencies concerned with this policy formulation and so on, have they reached out to the groups formed in the community of of persons with disabilities, so that inputs and so on can be made? Or have you, as groups, tried to put together some level of policy yourself and submit to the PTF or the NCDC and so on for review and acceptance, so that forms part of what is done for your community?
Well, in the first, I'm not aware that the PTF has reached out in the sense you're talking about. And then as for our organizations, I believe some groups have reached out to the PTF, but we've not had much response. So I was rather surprised this evening to hear that the PTF are adopting guidelines on human rights of persons with disabilities. It's a welcome news, of course. We do welcome, and we do welcome more of it. But unfortunately, another issue that we are very concerned about is lack of inclusion and participation of persons with disabilities. We're not even sure if there's any person with disability on the PTF, because if there was, there wouldn't be the wrong use of language to describe persons with disabilities, talking about physically challenged, talking about deaf and dumb and so on. So we have really not yet been fully included or made to participate actively in the work of the PTF. And you remember the convention, the United Nations Convention on the Rights of Persons with Disabilities, states very clearly in Article 4.3 that in decision-making processes of whatever nature, persons with disabilities should be involved. So we're calling on the PTF and relevant organs of government to include persons with disabilities in all these aspects. In the aspect of COVID-19, I mean, right from the beginning, we should have been consulted, and I'm not sure there was any consultation that went on.
Now, looking ahead, because again, while we wait for the organs of state and the organs of government to put together whatever it is that they're putting together by way of guidelines and so on, within the committee, and I make reference to the 2019 elections, one of the big issues that came out of that exercise was the issue of statistics and data that to capture people in this specialized communities, persons with disabilities, with how many of them have sight issues, how many of them have hearing issues, and so on. Has that problem been resolved now in terms of the statistics, so that even groups like yours and other such big internationally backed groups can reach out with specific numbers as to what it is that needs to be done in terms of protecting them in the COVID era, in terms of medications, in terms of what to do and all of that?
Well, in terms of the elections, INEC has done fairly well to ensure that some data is gathered. They got together 3 organizations to provide data, to collect data on persons with disabilities. So I think INEC is well placed to be able to work on data for persons with disabilities. But other agencies, other MDAs are still not yet prepared in the area of data collection. And data is very, very critical, you know, in ensuring that rights of persons with disabilities are respected.
I must ask you, because one of the things that has been, the issue has been testing. Has that been extended to the community?
Well, I wouldn't say yes and I wouldn't say no, but testing is a very, very important aspect of COVID-19. But I'm not well informed on that area.
Have you been tested, for example?
I have not been tested, and I doubt if many persons with disabilities have been tested. In fact, you know, in the area of all the equipment, you know, face masks and so on, it's doubtful if many persons with disabilities, particularly blind persons, even know what face masks are. We had to go around Lagos trying to distribute face masks and trying to ensure that persons, blind persons in particular, know how to use the face mask. So, you know, information is out there on television. A non-disabled person can see what is going, they can see what the face mask is, they can see how it is demonstrated, how you can use it. But there is no information for a blind person, for instance. I mean, blind person would need somebody that would explain to him or her the way and manner in which to use the face mask. And then also, definitely sign language. I must keep hampering on sign language. There is no sign language yet on television.
So what is what we have? When we see people do their hands and all of that,
yes,
what is that?
That is sign language, but it's not on television.
Okay, you mean traditionally as part of the whole ensemble?
Yeah, it should be part of everyday use, you know, on television, in press briefings, in public gatherings, and so on. It should like be the norm, really. It should be the norm for in the society, really, so that we can carry these people along with us.
Thank you very much, Mr. Danlami Bashar, Chairman of the United Nations Committee on the Rights of Persons with Disabilities. Thank you so much for your time today.
Thank you very much for having me.
It's a
I'm
pleasure.
really happy to be here. Thank you.
Thank you very much. We'll take a break, and when we come back, we'll take a look at this issue in a little bit more depth with a number of other stakeholders. To stay on with us. Thanks for staying tuned, and welcome back to our COVID-19 update. We can go now to Maiduguri, the capital of Borno State in Nigeria's northeast, and speak to our correspondent, Blessing Tuna, who joins us from our Maiduguri studios. Good evening, Blessing, and thank you for your reporting today. Let me begin by asking you, so from your report, you found that there seems to have been a gradual but dangerous relaxation of the guidelines. People are, for example, not wearing face masks anymore.
Yes, thank you, Ladi. That's what we observed today when we went to talk to the physically challenged people. But then we observed that, a large number of people in the city were not wearing their face masks. And, for the few persons that were wearing it, it is beginning to look as if, they are overdoing it. I don't know, maybe because of the number of people that have been discharged from the isolation, people are beginning to be relaxed, and they no longer take the issue of the pandemic serious. Maybe the initial fright was there. Everyone was scared and confused because there was little information about the disease. But now we have more people recovering, getting discharged from the isolation. So it's beginning to look as if it's no longer a threat. And you see people not observing the social distancing. You go to the market, you go to actually all public places are operating right now, except for schools. Banks are operating, even though we still have institutions that are strict. Like in banks, I know there's a specific number of people they allow into the banking hall, but then other places are not that strict. So you just see people going around, no social distancing. The use of masks is beginning to wane. You see the public tricycles, and every public place I have gone to today, I saw very few people using the masks. I wouldn't know for the hand sanitizers, or if people really bother to use the hand washing points, because there are a lot of hand washing points, in specific places, especially, in commercial areas and organized commercial areas rather, But, I don't see a lot of people, bothering to use it. And of course, we know the hand sanitizers are a bit pricey. Not everyone can afford it. So it is clear, and it is rather safe to say that people are beginning to be relaxed in the city of Maiduguri.
Coming to our talking point today, that is persons with disabilities, you also indicate that many of them cannot afford to care about this disease because their basic problem is one of survival. And if I heard you correctly, 70% of them sustain themselves by begging.
Yes, that's one of the issues that, the officials of the physically challenged raised with me today when we had the chat. They are saying that, they cannot afford to buy, for instance, a hand sanitizer, which ranges between 1,500 naira to 3,000 naira. And you begin to wonder, how much do they make in a day, from the alms they beg for on the streets, and you don't expect them to use it to buy hand sanitizers. And if you look at the visuals, running on the screen right now, none of them is wearing a face mask. And one of the things they told us is, it's as if no one really bothered, to consider them when we talk about the safety precautions and all of that. They say their people are not even sensitized, because what they do basically, they interact with a lot of people on the streets, which exposes them to all forms of danger, and they are not taking any precaution. Another issue they raised is, even if they want to use hand sanitizers, even if there are hand washing points and all of those things available for them, these are people that basically use their hands. You could see some of them use their hands when they move, and then the blind will need to touch surfaces, to touch walls and public places, just to move around. So So even if they wash their hands, I mean, the hands immediately get contaminated because they still need to use those hands to walk, to touch surfaces, and all of that. So one of the things they're advocating for is there must be precautionary measures tailored, specifically for them, because the protocols we have right now will not work for them, even if they had access to maybe hand sanitizer and all of those things, except for face masks that should work for everyone. But as it is right now, those things are not even, available for them. Those things are out of their reach, which is a matter of concern for everyone, not only for them.
Blessing Tuna, our correspondent in Maiduguri, the Borno State capital. Thank you so much for your reporting, and do stay safe out there. Joining me in the studios at this point is Dr. Aderi Sola Anifowoshe, who is a public health physician. Thank you and welcome.
Thank you. Good evening.
I've been told that we need to be very careful with the language. People with disabilities.
Yes.
Are they particularly vulnerable in any way under COVID-19?
Okay. People living with disability are not particularly vulnerable in the sense that they do not have the inherent tendencies to become more susceptible to developing COVID-19. Neither are they more susceptible to developing severe forms of the disease. However, there are underlying conditions that could have predisposed them to developing the disabilities in the first instance, and that makes them, those comorbidities and underlying diseases could make them more vulnerable to the disease. Also, the fact that they have the disabilities, they could, it will be harder for them to take the prudent steps in protecting themselves against the COVID-19 as expected of an average person, because they do not have the ability in them, they have the limitations to do exactly as it might be required of them at this period.
From the reporting, the Blessings report in particular from Maiduguri, many of them say that they can't even afford many of the basic things that have been recommended, hand sanitizers, face masks, but equally importantly, they talk about the enlightenment that most of those who are in that group have not received any enlightenment about what is going on and why it is important to them. Do you think that that is likely to present us with a problem, even if we get hold of the control of the normal infection rate that is currently what we are battling?
Yes, I agree with you. It's possible to have an issue if they are not properly considered in the scale of preference. I think they should actually be prioritized because they are at risk because of their difficulties and the limitations, the restrictions they have in actually protecting themselves. So I think we should have more strategic steps in tackling conditions as regards them, because we need to get more people involved, the community leaders, the religious leaders. They should be identified. The government should prioritize them because we have a lot of them. In Nigeria, we have about 25 million people living with one form of disability or the other. That is a huge lot, over 10% of the population. So they must be prioritized, and so we don't have a time bomb in our hands.
Looking at some of the other things that have since emerged in the general fight against COVID-19. Today, we heard from the PTF that even as we approach the end of the extended phase one of the ease of locking down, I know that's a mouthful, but that is the way it's been described, we must take a look back and see what are the gains and what we have to do to maintain those gains regardless of what happens. Do you think we have actually gained a lot, particularly during this extended period, this last 2 weeks that will end on Sunday?
Yes, we have gained a lot, but I believe we can still gain more. This group of people are not I'm not looking forward to having them released into the community soon. If this group of people can be engaged, if they can actively work from home, they are the group of people that you can encourage to work from home if they can actually maintain their livelihood from working from home. That being said, it is also important to give them palliatives, because with palliatives, they will be able to stay back at home and work, and then they will be able to comply to the directives. Also, that being said, I also believe we can also make health information accessible enough to them. Yes, we have community engagement has been ramped up, risk communication ramped up on the TV. And it's good that I had the guest you had earlier on speak on the fact that they've been neglected in a way. And I feel we can still learn. There's still time to act on that. We can involve them. They should be involved in the planning such that they can tell, they know where their problems are, and they will be able to identify and lead and guide directly to be able to meet their needs. Yes, I mentioned that health information should be made accessible to them in mode and means and formats that is made accessible to them. Then we can also ensure priority testing for people living with disabilities who come down with symptoms of COVID. They should be prioritized for testing, for tracing, and for treatment. This will help to really curb the spread of this infection.
What would you like to see going forward now? Would you like us to move to phase 2 of the ease of locking down, or do you want the phase 1 to go on for a little while longer? I know I'm putting you on the spot, but...
That is a tough one. It's tough in the sense that, yes, we need to protect the health of the people. The people must be protected health-wise, and we know that the virus will move once people move. At the same time, the livelihood of the people must be protected. And so we are in between, yes, should we continue? Should we ease the lockdown? So I will leave that to the stakeholders to make decisions on that. After weighing the benefits and the risk, of course, they will help us, and then they will be able to calm down and take the best decision, which will be in the best interest of the people. But being said, I will still emphasize that these people living with disabilities should be informed in the way that they would find acceptable and accessible. They should know, because they are vulnerable in a way, they should learn. Which proves
important.
Yes, makes it important. And then they should learn to stick to the essential social distancing rule. Of course, they will need the help of the family members if they have any like that. Support caregivers to help them, give them more education, enlightenment on how to stay healthy. They should avoid physical contact, maintain physical distancing, as we have always been saying and as we've been emphasizing. This group of people should have if they must go out, they should have their face masks on. The environment should be well cleaned up, because people who can see dirty environments, they know, they take caution. But people who cannot see, so family members should learn to keep the environments clean as much as possible with bleach solution. Clean surfaces, eye contact places, switches, and rails should be kept clean. And then the importance of regular hand washing can never be overemphasized.
Thank you so much, Dr. Aderisola Anifowoshe, for your time. Thank you for coming in.
It's been a pleasure having you. Thank you.
Let's go to Imo State, where the COVID-19 task force says it is in containing the spread of the coronavirus disease in the state, has stepped up action in enforcing some laid down guidelines, especially as it concerns intrastate transport service. Our correspondent, Tokwe Kute, has the details.
Matching words with actions, the Imo State COVID-19 Task Force is stepping up its game in enforcing the guidelines and protocols, especially as it concerns intrastate transport system. Today, the team monitored compliance on major roads in Owerri, the Imo State capital, by enforcing the use of face masks inside public transport, use of hand sanitizers, and social distancing. Some defaulters of these guidelines were arrested and charged to a mobile court.
The government is doing its best to make sure that the state is COVID-19 free. The government is doing its best to see that people don't go into transmitting other people. And by so doing, we all have to be at work to make sure that everything is done rightly. We know that people are very difficult to manage. From time to time, we'll keep sensitizing them, we'll keep enforcing things, and making sure that everything is done the right way.
We believe it is very, very important for us to step up measures to ensure that people comply with the COVID-19 protocol. Essentially, we have organized a mobile court to make sure that errant passengers are brought to book. The physical distancing measures, including mandatory use of face mask and hand sanitizers, are the things that we want to ensure compliance in the transportation system of this state in particular.
Since the outbreak of the coronavirus pandemic, Imo State has recorded 34 confirmed cases, but presently only 2 cases are active. From Owerri, the Imo State capital, Eyitope Kuteyi, for COVID-19 update.
According to the Nigeria Center for Disease Control, the NCDC, one new state recorded a confirmed COVID-19 case in the last 24 hours. Controversial as that is, Kogi State. Following 389 cases of COVID-19 infections in the country, the total cases now stand at 8,733. Meanwhile, 2,501 patients have been discharged and 254 deaths recorded. A breakdown of the figures by region show that Lagos in the southwest has the highest numbers still at 4,012, followed by Kano in the northwest with 936. The Federal Capital Territory in the north central maintains the third highest tally in the country with 519 cases. Borno State leads in the northeast with 257, while Edo in the south-south has 240 cases, and Ebonyi is still in the lead in the southeast with 36 cases. We go to New York in the United States now to join Professor Sherry Adeosun, who is an epidemiologist and a public health practitioner. Good evening, Dr. Adeosun. Thank you so much for your time.
Good evening. Thank you for having me.
We're talking a little bit tonight about people living with disabilities. In your experience and your practice in the United States, especially since COVID became all the rage, have there been particular provisions made for them, or are they particularly susceptible in any way during this period?
Thank you for that question. I will agree with the previous presenter. The disabled person doesn't have anything that make them more susceptible to COVID-19. It all depends on their age and maybe any other comorbidities they have. So being disabled as in whether they cannot see or they're deaf or they're dumb, cannot hear in itself doesn't make them susceptible to COVID-19. So it depends on the other comorbidities that they may have, whether it's COVID-19 or any other diagnosis.
Indeed. However, in keeping to the guidelines that have been announced, whether you're talking about face masks or social distancing, regular washing of hands, and all of that, people in this particular category will have some challenge in complying with those rules, even if all other things remained equal.
Yeah, that is true. So if someone has a particular challenge, of course, to use a face mask, and social distancing, especially if like you're blind, that is a challenge. But with the United States, there are structures in place because the people that are blind, they always have, depending on the situation, some have the support system as an assistant, so there are things that are set in place to make sure that this category of people, that their needs are met. And then face masks are being distributed all around the park in New York State, for instance. Face masks are being distributed, and they actually there are devices that for the blind that they can actually read what is going on, as in the new initiative, what we encourage them to do, hand washing. So those things are in place to support those people in that particular community.
Dr. Adeosun, please stay with us because when we come back after this short break, I want to ask you what the update is about the situation in New York, because not too long ago, New York appeared to have been the real big problem for the United States.
Oh,
so I want to know what the update is there. So please stay on with us. Thanks for staying tuned. Welcome back. We've still got Professor Sherry Adeosu. My apologies. I guess that got lost in the intro earlier. Professor Adeosu, thank you so much for your time. Professor Adeosu, of course, is joining us from New York in the United States. As I said before the break, New York was a very scary place not too long ago with pictures of mass graves and all of that circulating around the world. Has the situation improved somewhat? Because we are hearing that states are reopening, and just yesterday or day before yesterday, the New York Stock Exchange reopened.
Yes, things are getting a little better. There's a glimmer of hope that we're having. Like you said, New York has been the epic center. There's been over till date in New York, we have over 10,000 people that have died in New York. So it's really has been really crazy. But the good thing is the number of deaths per day is going down because the healthcare professionals are really doing all they can do, and the people themselves are maintaining the most important thing: social distancing, wearing face covering. So it's really mandatory for anyone. If you have to go outside, you have to wear face covering. Of course, hand washing is also very encouraged. So yes, it is increasing, it is reducing. So that is something to be grateful for. But it's not still where we want it to be, because there's still people dying every day from COVID-19.
Finally, I must ask you this, and I hope you could give me an answer in about a minute.
Okay.
The issue of states reopening, as is always the case, there's a fine balance. Where do you fall on that balance? Is it a good thing, or should they have been more cautious?
I think I I would lean more to be more cautious, in the sense that once we reopen, then when the people that are really infected, because the thing about COVID-19 is sometimes you might have it and you won't show no symptoms. So those are the areas that is really dicey. You have COVID-19, but you're not showing symptoms. Some people have it, they show excessive symptoms. So if those that have it with no symptoms are mingling with the community, that is where the challenge is. But I do understand the economic implication of not opening on time, and people that depend on daily living, daily livelihood, I understand that. Somehow we have to find a balance between keeping our people safe and healthy and also making them able to fend for themselves economically.
Professor Sherry Adeosu, thank you so much for your time. Professor Adeosu joined us this evening from New York in the United States. Thank you very much. It's been a pleasure having you with us.
You're welcome.
Staying in the U.S., where most small businesses are struggling as a result of COVID-19, while some are finding ways to stay viable. Of those businesses still operating, 60% reported a reduced workload, and 60% also report struggling with finances. Employee wages, bills, and rent were all top of areas of financial concern. Our Washington correspondent, Maria Bird, gives us more.
Small businesses in the United States have been hit hard by COVID-19. According to recent labor statistics, more than 50% of small businesses have laid off employees.
You get the money, you'll get it the same day. You use this to pay your workers. Please bring your workers back to work. If you've let them go, you have 8 weeks plus overhead. This is a very important program.
Many small companies are not able to utilize COVID-19 small business loans provided by the federal government. One Nigerian-American woman, Akiwa Asimoto, a small business owner, has instead applied for a small business grant, and she is hopeful.
I have a company called Eki's Famous, in which I do teach about self-esteem building through dance. I'm also a designer, so my core is all about self-esteem building and healing, which I've had since 2007. But I also have a nonprofit called Your Queens, in which we teach about African royalty through storytelling, song, and dance. I'm thankful for that busy season, because as COVID came in, everything paused. We had to cancel almost all of our gigs. I'm very organized, so I was able to have a calendar of everything for what we're going to do for 2020 with my team, with Your Queens and Eki's Famous, and now we had to put a pause on all of that. I am every day looking to apply for a grant. No loans. I'm looking to apply for a grant. So we are eligible. I did apply for the SBA grant. So just being patient and prayerful. It would help also fund my team, but not only fund my team, but we are able to provide free to low cost entertainment, educational programs.
While many U.S. small businesses have gone out of business, others, like Eki's Famous, are finding ways to rebuild and reinvent themselves for the future. From Washington, Maria Bird, Channel Television News.
And still staying in the U.S., the U.S. has now passed 100,000 deaths in the coronavirus outbreak. That's more fatalities than any other country, while its 1.69 million confirmed infections account for about 30% of all cases worldwide. This also means that around as many Americans have died from COVID-19 as from the Korea, Vietnam, Iraq, and Afghanistan wars combined. Meanwhile, several European countries have begun easing lockdown restrictions and are now employing the use of track and trace apps to continue to fight the pandemic.
Email or call people who test positive with coronavirus and ask who they have had contact with. Any of those contacts deemed at risk of infection will be told to self-isolate for 14 days, even if they are not sick. France is also set to launch its coronavirus contact tracing app as soon as the weekend after it cleared 2 parliamentary votes. The Stop COVID app will supplement work already being done by a French team of human contact tracers who are trying to identify people who may be infected with the disease but are unaware of the fact. Scotland is to relax some restrictions from Friday, allowing people to meet those from other households outside. First Minister Nicola Sturgeon says the number of people meeting between the two households should not exceed a maximum of 8 people, and meetings should not take place with a different household within the same day. Elsewhere, Russia's recorded death toll has passed 4,000, with its confirmed case total rising to 379,051.
The UN Secretary General Antonio Guterres has called for debt relief to be offered to all developing and middle-income countries amidst the coronavirus pandemic, urging the International Monetary Fund to consider boosting global liquidity by issuing a new allocation of its special drawing rights currency. The world's developing economies, already struggling with a rapidly growing debt burden, must now confront a record global downturn, plummeting prices for their oil and commodity exports, and weakening local currencies. The oil price drop has also hit some middle-income countries particularly hard. The group of 20 major economies, including China and the Paris Club of Government Lenders, in April offered to suspend bilateral debt payments by the 77 poorest countries for the rest of the year. So far, only 22 of the countries have requested to receive this. Thanks for being with us. I am Ladi Akere Doluale. That's our COVID-19 update at this hour. Good night.